As a side issue, note the finding of elevated FSH. I discussed that matter in some detail in my 5th video. FSH is a pituitary hormone that stimulates the ovaries and testes to produce the reproductive hormones. The secretion of FSH is controlled by the brain, and it becomes elevated in both sexes when ovaries or testes begin to fail. Our brains know how important the sex hormones are to our health and our survival, and are trying desperately to get our ovaries or testes to function adequately again. Studies on the testosterone-prostate cancer relationship are still coming out. In February of this year, 2008, no less an institution than the National Cancer Institute published a study. Their conclusion, quote, "No associations were found between the risk of prostate cancer and serum concentrations of testosterone," close quote. Many of you might be wondering how it was that the myth of testosterone causing prostate cancer got started in the first place. Harvard addressed that issue in their 2006 study. Quote, "In 1941, Huggins and Hodges reported that marked reductions in testosterone by castration or estrogen treatment caused metastatic prostate cancer to regress, and administration of exogenous testosterone caused prostate cancer to grow. Remarkably, this latter conclusion was based on results from only one patient. Multiple subsequent reports revealed no prostate cancer progression with testosterone administration, and some men even experienced subjective improvement, such as resolution of bone pain. More recent data have shown no apparent increase in prostate cancer rates in clinical trials of testosterone supplementation. Now, it is well known that the almost complete depletion of testosterone will stop most prostate cancers from growing. That's what drugs like Lupron, for example, accomplish. It's called a chemical castration. So the logical question is, if the absence of testosterone stops prostate cancer from growing, shouldn't the presence of testosterone promote tumor growth? The answer to that question is yes, but a very highly qualified yes. Here's Harvard's explanation. Quote, "The apparent paradox in which castration causes prostate cancer to regress, yet higher testosterone fails to cause prostate cancer to grow, is resolved by a saturation model in which maximal stimulation of prostate cancer is reached at relatively low levels of testosterone." What they are saying is that the amount of testosterone that will stimulate prostate cancer to grow as much as possible is very, very small. It's so small that even severely deficient men coming to my office have at least 3 to 4 times as much before they receive any replacement. The entire issue of prostate cancer and testosterone replacement boils down to this. If men with severe symptomatic testosterone deficiency still have much more than enough testosterone to stimulate prostate cancer as much as it can possibly be stimulated, where is the possible harm in them having more testosterone, enough testosterone to be healthy? If we step back and look at the big picture, we see that one study done on one patient 57 years ago has caused almost the entire medical community to ignore a hormone deficiency that plays a significant contributing role in aging, in most diseases, and in most causes of death. It's one more unbelievable chapter in the testosterone story. Now, after going through all this to show that testosterone has no connection with prostate cancer, I'm going to reverse myself. Because while testosterone certainly does not cause prostate cancer, I believe that the lack of testosterone is one of the major causes of prostate cancer, probably even the primary cause. This will be the subject of my next video. Please help me make everyone aware of the existence of this disease. Alert your friends and relatives. Email these video links to everyone you know. You'll be doing them all a great favor. I'm Dr. E. Barry Gordon. Thank you for watching.